My name is Jeffrey Trask, and I'm the founder and operation director of the Champaign County Christian Health Center. Guy came in looking for a prescription. He wanted to get it ordered at this location. The thing was that he lived far away from that location. It would take him an hour and a half to take the buses over to that area. I found out that he only had $8 and his prescription was $7. Walgreens' prescription would have been $15. So our patient just basically needed $8 more to be able to stay close to home and not have an hour and a half of bus riding to get his prescription. Those are the kind of reasons of why I feel what we do is important, to be able to provide those felt needs for people that need them. I love Champaign Urbana. It's a tight community. If you're there for a period of time, you get to know a lot of folks there. So you have that sense of community. We do have issues just like any community has. We have some healthcare statistics that need to be improved. Our infant mortality rates is one of the highest in the state, actually. That's despite having the University of Illinois being a beacon there. So it's basically a dichotomy of haves and have-nots. One of the things that you often see is, like for our dental care, we're pulling teeth, and we're often pulling teeth because by the time an uninsured person comes to our dentist, the teeth aren't really salvageable. They can't be saved because they may have never seen a dentist. But what I want to do is be able to get into the community with community health workers and be able to identify those needs before they become major problems. Because Champaign-Urbana is a tight-knit community, we have community meetings where we regularly come together once a month to find out who's doing what the needs are. So when we do have a patient that has a certain need, I know how to get them connected to those services right away. The only reason why it happens is because people are willing to volunteer their time and they own it. They feel like it's just as much as theirs as it is yours. We started off as a grassroots organization. We thought maybe like 5 people might show up just to show interest. Turned out almost 20 people showed up. And by the time we opened up our clinic a year and 3 months later, we had about 150 people who had attended one of those meetings and had gotten involved in some form or fashion. I really believe in economic justice, among other things, as racial justice. And by being able to have resources, we can actually practice that in our community. We can not only bring healthcare to those who are in need, but we can also bring economic well-being to those in need.